Hi, I'm Dr. Patrick Foy. I'm a professor and I'm the director of the Coccyx Pain Center. And in this video, we're going to talk about a topic called Coccyx Pseudospurs. And this is from an article that I have on my website, tailbonedoctor.com. If I've sent you this link, it's because I want you to read up on this information. It may be relevant for your cause of coccyx pain. So just basically clicking on the article here. This is, again, Coccyx Pseudospurs, and we're going to talk about what that means. And basically, it's the tailbone going into extension, and that being a cause for tailbone pain, coccyx pain, coccydynia. So there's lots of different causes for tailbone pain or coccyx pain, and this specific article and video is going to focus specifically on tailbone extension, or the Coccyx Pseudospur as it's called. Normally, the position of the coccyx is that the coccyx is in flexion. So the sacrum and coccyx have a mild gradual forward flexion to them, and that means that the coccyx is flexed forward in a way that makes it tucked into the pelvis. And that protects the coccyx because if you sit onto a chair or you fall onto the ground, the tailbone is not extended or sticking out where it would have trauma or injury or be a source of pain from as much from those activities. But sometimes there's an abnormal position where the coccyx is going into extension instead of flexion. So basically, the angle is going the opposite way. And again, here we mean by the opposite way that the tailbone is in extension instead of flexion. And that results in the lower part of the coccyx sticking out or pointing, pointing backwards in its position. And in that sticking out or extended position, the tailbone is at risk for hitting or bumping against the chair when you sit, especially if you sit, leaning back. There's usually pain with sitting and pain with especially sitting leaning partway back. And in that extended position, also, if you were to, it's at risk for forcefully or traumatically hitting against the ground or floor if you were to land on your buttock region after a slip and fall. So just reviewing a couple of the terms, the phrases or terminology here and some of the similarities between a bone spur and a pseudospur. These are different phrases that doctors use to describe abnormalities where the lower part of the coccyx has bone that's in extension. So again, this is the tailbone going into extension instead of flexion. But the difference between a pseudospur and a spur, the word pseudo in medicine means like or similar to. So a pseudospur is like a spur. And basically that means from a clinical perspective in terms of the symptoms that it causes and in general as far as most of the treatments, a pseudospur is essentially like a spur. So again, that pseudospur means that the lower coccyx is in an extended position, and then it's going to cause the same types of symptoms that a bone spur causes, which is again typically pain with sitting and especially pain with sitting leaning partway back. So if that's the ways that bone spurs and pseudospurs are similar, how about the ways that they're different? Well, we'll define each of those, a spur, and then down here we'll get to the pseudospur. So a bone spur is when there's thickening of the bone. It's made of bone, it is bone, it's just additional extra thickened bone forming in a very focal, localized spot. So just like your skin can have an area of thickened skin, and you get a callus on your skin, similarly, bone can have an area where there's thickened bone forming a bone spur. So again, a bone spur is where you have additional extra bone that has formed. And when there's this bony thickening, it often makes a very pointy projection, and that's referred to as a bone spur. The European doctors sometimes refer to it as a bone spicule, but a bone spur or bone spicule, the same exact thing. On imaging studies, a bone spur looks almost sort of like an icicle hanging down from a rain gutter. It has this, sharp, pointy projection, most commonly. And typically that at the coccyx, the bone spur happens right down at the lower tip. And again, that's going to cause pain when somebody sits. And the reason it causes pain is because the skin is going to get pinched in between the chair that you're sitting on and that bone spur. So that's a bone spur. How about a pseudospur? Well, again, pseudospur means that it's like a spur, meaning it's going to cause similar symptoms, but it's not the exact same as a spur. And the main difference is that, as I mentioned above, a spur has additional bony material, whereas a pseudospur does not have any additional or extra bone. It has just the normal bones that, that would be there in anybody else, just that the lower part of the coccyx is going into extension instead of flexion. So the result clinically is very similar, just that the anatomic abnormality that causes those clinical symptoms is different. So again, the pseudospur is going into extension. Sometimes that's referred to as retroversion. So again, instead of the coccygeal bones being flexed and tucked in, one or more of the joints at the coccyx are going into extension instead of flexion. Imagine, as a comparison, imagine trying to put your hand into your pocket. And normally when you would do that, you probably flex each of your fingers a little bit to get your hand to smoothly slide right into your hip pocket. But now imagine if your pointer finger, your index finger, was extended instead of flexed. That extended finger is going to get hung up and it's going to bump into the edge of the rim of your pocket instead of smoothly, being tucked in to your pocket like the other fingers. Similarly, your coccyx being extended means that instead of it being smoothly tucked into the pelvis, it's going to bump into the seat that you're sitting on. So that is the basic mechanism by which a pseudospur, or extension of the tailbone, causes pain. The European doctors sometimes refer to this extension as retroversion of the coccyx. It's just the medical, one of the medical terms that's sometimes used. So then we have to put this into the clinical context. Right here I've been talking about the anatomy, and which is something that typically shows up on your imaging studies. But to put things into the clinical context, we mainly look at three different factors. And the doctor needs to consider all three of these main factors to make a clinical diagnosis. And number one is the symptoms. What kinds of symptoms is the patient having? In the case of coccyx pain, is it specifically at the coccyx versus other areas in the pelvis? And at the coccyx, is it specifically at that lower part of the tailbone? Is the symptom of pain made worse by the person sitting, and especially sitting leaning slightly backwards? Those would all be symptoms that would be consistent with coccyx pain, and consistent with coccyx pain coming from a distal coccyx bone spur or a pseudospur. And other things can cause those symptoms as well, which is why we move on to the next step of these three factors, which is physical exam. And the doctor needs to specifically look at the skin over the area of the site of pain. And the doctor really needs to touch or press on different areas along the length of the coccyx. And pressing or touching on that area, medically we call that palpation. And we're looking to see if we can reproduce the symptoms that are causing your pain. It's very, very common that patients travel in to see me, and they've seen several different doctors, and patients will tell me that none of the doctors actually examined their coccyx or the symptomatic area, or they never touched on the spot to see exactly what was the source of the patient's pain. But this is a really important component. And for a distal coccyx bone spur or for a pseudospur, for both of those, the specific location of tenderness will usually be at the lower half of the coccyx, and often especially at the lowest tip, or the lowest edge of the coccyx. In addition to looking for physical exam findings of the coccyx, the doctor often should be assessing for other sources of pain as well, for other possible areas that may be causing pain referred there from other spots in the pelvis or buttock region beyond just the coccyx. But again, this is, we're just focusing on the highlights here. So that's the symptoms and the physical exam. The next step is the imaging studies. And the imaging studies is basically where we're looking at things like X-rays, MRI, CT scans, and if those imaging studies are done properly, and admittedly there's a big problem often in having the imaging studies done properly at many places that are not familiar with treating tailbone pain, but if they're done properly, the imaging studies can typically show a lot of detail regarding the coccyx anatomy. And that's really going to help to show whether somebody does or does not have a bone spur, which again is also called a bone spicule, or whether they have a Coccyx Pseudospur, which again is also called a retroversion or a retroverted coccyx or an extended coccyx, a coccyx that's in extension instead of flexion. Now, imaging studies can also show lots of other things, but again, for this article and video, we're just focusing on pseudospur and bone spur. So basically, we would be looking at all three of these factors, the symptoms, the physical exam, and the imaging studies, and looking to see in combination, does it make, does everything fit together in the clinical assessment? If the patient's, symptoms, physical exam, and imaging all point to the same thing as being the cause of the person's symptoms, then the diagnosis is considered to be confirmed and well established. And once you have an established diagnosis, then we can move on to various treatment options. So in summary, I hope that this has been a helpful explanation for you about Coccyx pseudospurs, again, extended or retroverted coccyx as a source of coccyx pain. And I hope that this also helped to explain the similarities and differences between Coccyx bone spurs and Coccyx pseudospurs. On the article, I do have an image on here showing a bone spur. This image is a little bit distorted or lengthened just the way it's appearing on this web browser, but regardless, you can see here when we talked about that pseudospur, that pointy projection coming down. So instead of this gradual forward curve, there's part that's extending back here, that and that's going to cause pain when you sit and lean back because you're going to be leaning right onto that pointy area. So that's the bone spur. On this page at the moment, I don't have an image of the pseudospur, but I'll probably be uploading that in the future if you come back to this website. So again, hopefully the image has been helpful for you and helps to explain the differences between a coccyx spur and a pseudospur. You can find more information on my website, tailbonedoctor.com, and that's all for now. Thank you very much.